I am Dr. Ashrafur Rahman from Bangladesh. Good morning to all. Wishing you all a warm welcome and a healthy life due to this unimaginable situation for COVID. We all had at an 266th birth anniversary of Haniman online. I am especially thanks ifph for arranging this Zoom meeting continuously and bringing in numerous homeopathic doctors from all over the world in a single platform to share these views and experience. In this health world, I find peace by realizing that if Hahnemann was not done, then homeopathy should not have been born either, and because of the reason even we would not have the opportunity to come together. Today, I would like to share an immense experience of my life with you all. On January 2013, I received an invitation through an email from Germany in which on 16th February, I was invited in Hahnemann's house in Cothen, Germany, for celebrating the shifting of headquarters of LMHI, that means Liga Medicorum Homeopathica Internationalis. I can't even describe in words how much amazing, emotional I became at receiving the invitation. Honestly speaking, I spent a couple of nights without sleeping after that, because nobody from my country has never got the chance to visit Hahnemann's house ever. So I was eagerly waiting for that day to come by the grace of the Almighty. On the 16th of February, I was able to join the celebration which was held on the very house of Sir Samuel Hahnemann. The house is now maintained by the government trust of Germany. So after the celebration was over, I had the opportunity to stroll around Hahnemann's house with the other respected guests, sharing some of the memorable moments with you all. Just a minute. This is the celebration speaks of my Hahnemann house. Also, same things outdoor in Hahnemann house.
We are not seeing the slides, so you have to share, doctor. We are not yet shared. Please,
yeah,
and please play the video or please show the pictures. Your
okay.
only the share screen option is coming. You have to show the pictures on the screen.
Yeah, right, okay. It's fine.
Not yet. I think you are not yet shared. I think you opened the.
This is okay.
No.
Sure.
Maybe you go back and share it again, once again. Stop sharing and share once again.
You share it.
Yeah.
Uh, this is the celebration ceremony in 2013. This is my picture. He speaks my picture. Okay. Then this is Handyman house. Yeah. It's also the outside of Handyman house. The gate of Handyman house room. It's also with our colleagues worldwide. Inside of Handyman house. Sharing the celebration committee. Handyman societies. It's another picture. This is the Liga Medica Homeopathic Internationalist stand in here. I am sharing to in my left in Dr. Thomas Pingborough. He is the community of homeopathy, European community of homeopathy president, and in middle is Cotton mayor, and then Dr. Matuk, so is Mexican doctor, and me there. This Hanneman box. This is also Hanneman. There is preparing the medicine. Is also this chair and table also is box in there. I am signed the review Hanneman House books. We are enjoying there. A lot of Indian doctors also with me. This is European community. This is building of community library. So inside the European Hanneman library in there. So I am giving a speech of press briefing. Finally, ending my speech with the photo which I am standing with the bed of hanging. Thank you very much. This is the short speech of mine. Now I am going to introducing to you all the doctors from Bangladesh. Dr. B. Vidhar is here.
Please stop sharing your screen, doctor.
Yeah. Yes, Dr. B. Vidhar. Yeah. In here, unmute yourself.
Yeah. Good morning, everybody. I am Bibi Dor from Bangladesh. And
First I am introducing you.
okay.
Dr. B. Vidhar. He has complete DHMS and PDT home. Secretary of Education, Training and Research, Bikash. Treasurer of Homeopathy Doctors League of Bangladesh Society. Vice President of Homeopathic Study Group Bangladesh. Member of DHMS Doctors Association. His topic: status of homeopathy facing COVID-19 in Bangladesh. Please, Dr. B. Vidhar.
Okay, thank you, Ashraf, Dr. Ashraf. Good morning, everybody. I want to give a short picture of homeopathy during this pandemic situation in Bangladesh. You might be aware that in Bangladesh, the LMHI members have constituted HDLBA, what our president told it was Homeopathic Doctors Liga Bangladesh Association is the full name. During this pandemic situation, we tried to tackle the situation through our homeopathic remedies. The function of this organization, HDLBA, is to advance homeopathic activities around the country through treatment and training up the new doctors comes out every year. During this corona situation last year, HDLBA constituted a 5 members committee to build up a protocol how to tackle the situation. The protocol, I better say it's guideline. It had been submitted to the DG Health and Family Planning, the authority of health sector in Bangladesh, for approval of the government to administer homeopathic medicine during the crisis period. But it's a matter of regret that all went in vain. We were not allowed to work with homeopathy during this crisis situation. In this situation, all the homeopathic practitioners work on their own efforts to tackle the situation, and the result was very good, I must say. At last, we had a month-long campaign. We could do it because of the cooperation of mayor of Narayanganj City Corporation. Narayanganj City Corporation is the locality area of our president Ashraful Islam. So we ran a clinic there. We gave remedies for the persons who are more or less affected, and also we gave gave protection through what to say, to protect the outbreaking. This was obviously the arsenic. Arsenic was settled by Ayush in India, and they had best result during the pandemic as protective medicine. We do so applied this medicine as preventive measure. The result was very appreciable. Besides this, we treat the patient as homeopathy treats the patient, not the disease. We applied many medicines as bryonia, phosphorus, rastus, belladonna, calicar, pulsatilla, marxol, arsenic, album, aconite, lachesis 2, sulfur, lycopodium, hipersal, veratrum album, nasvum, influenzinum, etc. Influenzinum and arsenic was used for preventive measures, and its result was very nice. If you think that our major portion of our population is very helpless and poor people, those people have to go every day for their earning, and they do not adhere to the government's restriction. They come out, they do not follow the government orders because of their earning, and most of them took our medicine and they did their job. Though government is taking much measures to protect the people, yet our homeopathy also had a great cooperation to tackle the situation. During this period, the symptoms we followed through repertory, scans repertory, nose smell, wanting or lost, suppression of urine, anxiousness, respiration difficulty, and so and so. And we selected these medicines, I said earlier, for treating the patient of coronavirus in Bangladesh. I will give a picture now. If you see the status, you will find ours. We are 33 number out of 221 probably. Death here yesterday was 77. Total cases 6,78,937. New cases plus 5,343. Total death is 9661. Total recovered 572378 persons. Active cases 96898. Serious critical, no, nil. Total cases per million 4,091%. Death per million 58. Whereas in America, the richest country in the world is 1731, 1,731 persons per million. In that case, I think we are far better. And this was able, I think, for homeopathy. Large number of people takes homeopathic treatment, but it is not focused. It is not focused because of the capitalist. I believe government has sympathy for us, but cannot ensure as because of the pressure from the capitalist worldwide probably. And that's all. Thank you very much.
Thank you, Dr. B. Vidor. Now, second line, Dr. MD Ruhul Amin is here. Please unmute yourself, Dr. Ruhul Amin. Dr. MD Ruhul Amin, the young genius homeopathic physician in Bangladesh. He has completed BHMS from Dhaka University, lecturer also, chronic disease, case tracking and repertory, working on Government Homeopathic Medical College, Dhaka, Bangladesh. His topic for today: genetic disorder, osteogenesis imperfecta. Please, Dr. MD Ruhul Amin.
Dear all doctor and friends, Assalamu alaikum. Good morning to everyone. I am Dr. Ruhul Amin, lecturer, Department of the Chronic Disease, Case Taking and Repertory, Government Homeopathy Medical College of Bangladesh. At first, thanks to ifph organization for such type set up such type of virtual program. Now, today, I present a case of genetic disorder osteogenesis imperfecta, which is completely cured by homeopathic treatment. Before slide presentation, I shortly brief the case. Twin baby, age was 4 months, was treated in 3 renowned hospitals in Bangladesh. Lastly, the patient referred to BSMMU, that means Bangabandhu Sheikh Mujib Medical University, which is only one medical university of Bangladesh. After treatment of 19 days at BSMMU, this patient day by day going to bad condition. In such condition, one of relative of the patient contact with me for treatment. They asked me have any possibility to cure this disease in system of homeopathic medicine? I request them to send all papers to me. Then I studied the case thoroughly. One day after this patient was appointed my chamber, 3 hours times had passed away for their taking case. After long time observation and case taking, I found some clue which was very important for selection of remedy. I assured the guardian, I think this case may be cured if you take the medicine properly and timely. Now, let's go to see the presentation of the case.
Dr. B.B. Dot, please unmute yourself.
Welcome presentation, a case of genetic disorder, osteogenesis imperfecta. Particular of the patient, name Ujay Shara, that means twin baby. Age 4 months, sex Ujay male, Shara female, Kumilla, Bangladesh. Date of admission 5/6/2017. Ujay Shara. Chief complaint, pain and swelling of right leg for last 1.5 months of the babies. History of present illness, swelling the right leg, which first involved the right knee joint, then gradually the whole leg, including the right foot, and 2 weeks later, Ujay developed swelling of the left index finger, also proximal part of the middle finger and ring finger. They had a history of given intramuscular vaccine on the right thigh. Prior to 5 days, this illness. Mother also gave history of excessive cry, which did not stop after adequate feeding. On query, they had low grade of intermediate fever during the onset. Subside by taking paracetamol, however, the fever was not documented. After 10 days back, mother noticed that Ujair was not moving his right upper limb. It became swollen, and that time an X-ray was done immediately, which revealed fracture of the long bone of his, and the patient was advised to admit the baby at BSMO. They have no history of trauma or any non-accidental history prior to this illness. No history of easy brushing teeth. Treatment history treated with several antibiotics like cephaloxamine, cephradine, cefixime, fluoxetine, and etc. Ujair's right forearm was immobilized with plaster cast. History of past illness, no significant past illness, birth history, antenatal history. Mother was patient of hypothyroidism, which is diagnosed 33 weeks of pregnancy and was treated with levothyroxine for last 6 months. She had no history of fever, rash, hypertension, diabetes in her pregnancy period. Natal history, the born was 37 weeks of gestation at private hospital by Lux, which average birth weight. Development history on age appropriate, feeding history normal, immunization history, immunized as per as schedule, social history middle class family, family history none of their patient do not and no other family member says such type of illness. Physical examination, appearance both our babies are fruitful, pallor, mildly pale, jaundice, cyanosis, edema, dehydration, everything absent. General examination, lymph node not enlarged, BCG mark present, sign of meningeal irritation absent, ear, nose, throat normal. Vital sign, respiratory rate 22 per breath per minute, heart rate 128 beat per minute. Shara, respiratory rate 22, heart rate 120 beat per minute. Examination, locomotor system examination, lower limb, there is no joint swelling, but right leg swollen below knee to foot, skin shiny, tenderness, left leg no swelling, upper limb, right forearm of Ujair, plaster cast in situ. Alimentary system normal, but liver is palpate and less 2 centimeter from right costal margin along with mid clavicular line. Other systematic examination, no abnormality, saline feature. Ujair and Shara, 4 months old twin babies of non-consanguineous parents healing from Kumila, admitted on 5/6/2017 with the complaint of pain and swelling of the right leg for last 1.5 month, followed by swelling of left index finger, third and fourth proximal phalanges of Ujair. 10 days before admission, Ujair develops spontaneous fracture of right radius and ulna, for which he was given plaster cast. They had history of given second dose of pentavalent vaccine on right thigh 5 days prior to this illness and low grade of fever at onset of the disease. There is no history of trauma or non-accidental injury. They were treated with multiple antibiotics for last 1.5 months. None of their parents or other family member has such type of illness. On examination, both the babies are fretful, mildly pale, eye normal, febrile, vitals are within normal limits. They are well thriving. There is a plaster cast in situ in Ujair right forearm. Right legs of both the babies are swollen tenderness. 3/4, no pressure of arthritis, hepatomegaly present. Diagnosis. Provisional diagnosis, osteogenesis imperfecta. Osteogenesis imperfect, point of in favor. History of spontaneous fracture, similar illness in twin swelling of leg. Differential diagnosis, osteomyelitis, scurvy, congenital syphilis. Osteomyelitis, in point of paper. History of intramuscular vaccine in right thigh, history of fever, swelling, and tenderness of right arm. Point against spontaneous fracture, multiple bones are involved. Scurvy, point in favor, history of logate fever, pitbull, swelling, and tenderness of the legs. Point against spontaneous fracture, no gingival lesion, no scorbutic lozari, no petechiae in skin, no pseudoparalysis. Congenital syphilis in point in favor, skeletal changes, multiple bone are involved, hepatomegaly, point against, spontaneous fracture, no history of skin rash, no history of IUGR, no renal involved, no pseudoparalysis. Investigation. In investigation, everything CRP normal range, no growth, creatinine normal, hemoglobin, okay. X-ray, Ujair, right hand fracture, lower limb X-ray, it is Shara, X-ray of lower limbs. Investigation, serum TPH negative, Ujair, Shara দুটাতেই both are two negatives. Serum calcium 11.6 milligram per deciliter, slightly raised. Ujair. Sara normal, not done. Vitamin D normal. serum LTP is raised, serum phosphate raised. Treatment. Counseling the patient about the disease, its treatment option, complication, and prognosis. Injection, other antibiotics are applied, calcium, vitamin are supplied. This slide was first presented in PSMO. I show this slide which is shown in the BSMO. Here, follow-up. This follow-up in BCMO. Shara developed swelling of the right arm. Assessment fracture of the right side humerus, X of the right arm. Follow-up day by day bed condition. X-ray of right upper limbs after second follow-up. Shara, upper limbs fracture. Follow-up is date, day by day. Decrease their condition. Bone scintigraphy, multiple sclerotic lesions are found in different part of the body. Bone scan report, right wall leg soft tissue inflammation, increase radio tracker uptake in mid-shape of the radius, ulnar, humerus, multiple osteoblastic bony lesion involving the tibia, humerus, and femur. That means all of body are infected. Follow up. Ogier develops swelling of the right upper limbs. X-ray of upper limb ogier. Note on discharge. In such condition, patient day by day decrease their condition. The patient guardians are not agree with the hospital. These patients are not admitted in their hospital. On notes on discharge, injection biphosphonate was given. Discharge the patient 24/6/17. Patient was admitted for 5/6/17. Discharge 24/6/17. Plan follow-up after 3 months, advice genetic analysis. Discharge from the report BSMO hospital. Slightly introduced to definition of osteogenesis imperfecta. Literally means imperfectly formed bone. People with osteogenesis imperfecta have a genetic defect that impairs the body's ability to make strong bone. Osteogenesis imperfecta, also known as broken bone disease. Cause. This protein, main cause, the type 1 protein collagen, type 1 collagen type protein is the main cause for this disease. In people with osteogenesis imperfecta, one of the genes that tells the body how to make a specific protein does not function. This protein is a major component of the connective tissue in bones. Type 1 collagen also important in forming ligament, teeth, white outer tissue of the eyeball. Sclera. In some children, neither parent has osteogenesis imperfecta. In these cases, the genetic defect is a spontaneous mutation change in the gene and it stop function correctly. Sign and symptom: bones breaks easily, bloating to the white of the eye, short height loss, joint hearing loss. Treatment: there is no cure in modern science of medicine. Lifestyle, healthy lifestyle, maintaining exercise, etc. After homeopathy testing, some symptoms are collected from the patient. Totality of symptoms of both patient, child both are screaming, both are chilly patient, osteogenesis imperfecta, bone easily fracture, profuse perspiration on head, vaccination elements after investigation, repatriation of the case. I use the repertory radar software. Here, this rubrics takes from synthesis repertory and Robin Murphy repertory. Bone osteogenesis imperfecta, vaccination element, reaction elements from children, screaming children, had perspiration, scalp, sleep during, bones brittle bone, child held infants cannot hold up large. Treatment after 1 month later, screaming, sleeping improvement, skimming within 2 or 3 days after they are very calm. Skimmings are not all hours. From during the case taking, patient's mother complained me within 24 hours, the patient 20 hours are skimming. But after medicine applied, patient skimming normal condition, sleeping improved, no new swelling fracture occurred, appetite good, other physical symptoms have improved. Improve all side of body condition, but occasionally courageous seasonal fever appeared, but lasting few times. Last visit 3/4/2018, patient now trying to walking without any major complaint, without any fracture. All broken fracture are healing by this time, before, after treatment. Some picture of this patient, plaster cast, Shara Ujair. This is Shara. After treatment of 3 months, Shara. Ujair, now she completely cured with homeopathic medicine. There is no fracture still now. They can move, walking and playing in normal condition of other children. Their development growth is normal as like as others. Shara. This is the Shara's and Ujair's fathers. They are very satisfied with homeopathy medicine, and this condition, when it comes to me, their guardian is very hopeless because one of the best university of Bangladesh, Medical University, Bangabandhu Sheikh Mujib Medical University, there is no cure treatment, but in homeopathy, they are very effective result and very satisfied on homeopathy treatment. Thanks you for watching this slide presentation. Thanks everybody for watching this. Thank you.
Thank you very much, Dr. M.D. Ruhul Amin, for your very special speech. Now I'm going to our next speaker, Dr. M.D. Nazrul Islam Khan. Dr. Nazrul Islam Khan, you're in here. Yeah, please unmute yourself. Dr. Nazrul Islam Khan.
Yes,
Okay.
thanks,
Uh,
Dr. Ashraf.
wait, I will be gifting you. Okay. Dr. Nazrul Islam Khan. He passed DHMS and also PG from London. He is a lecturer in Homeopathic Medical College and Hospital, working PG guide, Hanneman College of Homeopathy, London, Secretary General, Homeopathy Doctors League of Bangladesh Society, Joint Secretary General Bangladesh Homeopathic Parishad, also member Liga Medicorum Homeopathica Internationalis. His topic for today event is scientific explanation of homeopathy by Dr. Hanneman. Please, Dr. Nazrul Islam Khan.
Thanks, Mr. Ashraf. Very good morning and greetings to all participants. I'd like to thank ifph for giving me the opportunity to share something in the grand celebration of World Homeopathy Day. So I'm going to share my presentation. Can you see the presentation?
Yeah.
Thank you. So the scientific explanation of homeopathy by Dr. Hanneman, presented by Dr. Nazrul Islam Khan. Since we are discussing about the science, obviously we would like to discuss about the scientist. You know that Dr. Sir Isaac Newton is born in 1643, and his remarkable work is Newtonian mechanics, universal gravitation, calculus, Newton law of motion. So Newtonian mechanics and Newtonian law of motion both are highly connected with these topics. The Newtonian mechanics, at the year of 1700, Newton discovered and announced universe is equal to matter. Based on Newtonian mechanics, conventional allopathic treatment model known as scientific treatment model. So today we know the allopathy, they are conventional treatment model. They are the scientific model due to this Newtonian mechanics. And what is matter? Universe is equal to matter. What is matter? We would like to know. Matter can separate and study. So based on universe is equal to matter theory, concept developed for treating the organ-based disease. In this time, the conventional treatment, they are doing organ-based disease, and they for the scientific on the basis of Newtonian mechanics. Next, you know, is the father of alternative medicine, Dr. Samuel Hahnemann. He born in 1755, and Hahnemann's study Hahnemann studied medicine and graduated MD at the University of Erlangen on 10th August 1797, qualifying with honor. In 1781, Hahnemann took a blessed doctor's position. After 3 years of practice, Hahnemann was dissatisfied with the state of medicine. He claimed that the medicine he had been taught to practice sometimes did the patient more harm than good. He told that my sense of duty would not easily allow me to treat the unknown pathological state of my suffering brother with this unknown medicine. The thought of becoming in this way a murderer or malefactor towards the life of my fellow human beings was most terrible to me, so terrible and disturbing that I wholly give up my practice. Abandon medical practice. After giving up his practice around 1784, occupied himself solely with chemistry and writings. Hahnemann made his living chiefly as a writer and translator, while resolving also to investigate the causes of medicine's alleged error. So Dr. Hahnemann was a good chemist. So what do you mean by chemistry? We know the chemistry is a scientific discipline involved with elements and compounds composed of atoms, molecules, and ions, their composition, structure, properties, behavior, and the changes they undergo during a reaction with other substances. As a homeopath, we all know about the history of discovering homeopathy by Dr. Hahnemann. Due to shortage of time, I am skipping the history of discovery. My only focus to provide the scientific evidence. After prolonged research and study, Dr. Hahnemann came to the conclusion and given the observation. The Newtonian mechanics, universe is equal to matter, not reflecting in his research and study. This is the turning point. Hahnemann observation. He found that it's looked like an energy and generating wave. Energy wave can't separate and study. It's a whole. The concept comes treat the patient, not the disease, by Dr. Hahnemann from this study. So for Dr. Hahnemann's study, he observed that the conventional treatment, the science of conventional treatment not matching with his study. Dr. Hahnemann's further study, more substance, more reaction or aggravation, less substance, mild reaction or aggravation. Research of 50 millisiemens, he observed that generating energy wave by succussion. Hahnemann's further observation at the theory of for every action there is an equal and opposite reaction, having the serious side effect for using the chemical crude medicine. Nowadays, this is the Newton's third law. We all know about that. But Hahnemann's observation rejected due to theory of Newtonian mechanics, universe is equal to matter. That time, the authority is rejected, and due to non-scientific, because that time Hahnemann can't prove scientifically, but those who studied and observed, they explain. Now time, the golden time, the Albert Einstein, the founder of quantum mechanics, one is you see he's here 1879. quantum mechanics at the year of 1925, based on quantum mechanics, the world able to know universe is equal to matter, energy, wave, and heat, light, electricity. We know the matter and energy is far, far difference. So the Newtonian mechanics, universe is equal to matter. Newtonian mechanics proven wrong by quantum mechanics. So at this stage, the Newtonian mechanics proven wrong by quantum mechanics. When Newtonian mechanics proven wrong, at the same time, as per quantum mechanics, universe is equal to energy. After 100 years, Dr. Hahnemann proven true scientist, and the homeopathy become purely scientific. And at the same time, the conventional treatment model became non-scientific. But we can't prove. But why, you everybody know? At the theory of Newton's third law, for every action there is an equal and opposite reaction, having serious side effect for using the chemical crude medicine based on wrong scientific treatment model. You know, you see here, death by medicine, Gary Null, PhD research, and the website is www.garynull.com. Here, the leading cause of death, iatrogenic illness. You know the iatrogenic illness, the side effect of chemical medicine, conventional medicine, and the error of treatment. So we know nowadays what happening. So tremendous improvement in medical science, but deterioration of human health. What is the solution? Of course, homeopathy, because homeopathy is scientific. So, you know, nowadays we are observing around the world the human health deteriorating day by day, although medical science is improving. So if the human being not get the opportunity to treat, the homeopathy is the purely scientific medical treatment, they can't improve, or we can't actually improve the human health. So thank you for giving me the time. So actually the shortest of time, I finished my presentation and with little explanation. Thank you very much.
Thank you very much, Dr. Mohammad Nazrul Islam Khan. Our time is over. That's why, because now is our country 10:30, just 10:30. Dr. Sujit, you're in here.
Sir, thank you so much. We will send you the certificates. Just send you the email address in the chat box. We will send you the certificate as soon as possible.